One day a man came to the hospital to see his GP because he had fever and back pain. Everyone thought it just a common infection, so that's why they gave him just antibiotics and sent home. But later on, one day, he lost control under his legs and wasn't able to walk, which was a very dangerous sign. Hello, this is Dr. Dinara and my channel Diagnosis Bona Croatia Bona. Today I would like to talk to you about some mystery medical cases, which is quite difficult at the first glance to know what exactly the condition is. And today we are talking about Alex. Let's say Alex, and he was a 32 years old software engineer, and he was a generally healthy person. And one day he came to his GP with a fever, chills, and some back pain. What would you think the condition is? So please comment down below. It's interesting. What would you guess? What you would think about this condition? Okay. And now I would like to tell you how this happened, how we think, and how we find out what's happening with him. Alex doctor thought it's just a pyelonephritis, so he gave him some antibiotics for pyelonephritis and sent him home. But later the pain became worse and it's become more localized to his spine. So this Alex came again to the hospital, and now they started thinking about some muscle spasm, or it's because of the hernia in the spine. That's why they did an X-ray for him, but found nothing, and that's why they give him just more stronger painkillers, some miralaxans, like to make this muscle more floppy, and send him home again. It's a collection of pus in the epidural space, and it can compress the spinal cord, which can cause a very dangerous complications like paralysis. So it's when the person can't move his legs anymore. So that's why it requires immediate management. Just a few hours later, he already was with the surgeon. They drained this sac with the pus, and after some weeks of antibiotics, he was able to walk again, and he completely recovered. But why this case was so interesting? Because spinal epidural abscess is not the disease that you will think about like from the start, from the first glance at this person with a fever and a back pain. It's difficult to rule out without MRI, and it's a condition which has to be treated immediately. That's why this person didn't get any serious complications and he recovered completely. Thank you very much for watching this video, and I'm ready to share with you with other stories, and please comment below if you would like to know other stories as well, and did you like it, or you just want some medical information, some about me telling you about some conditions. But I'm happy to share with everything. Thank you very much, and bye bye.